Hey there, and welcome back to the channel where we dive into all things health, wellness, and relationships. Today we're addressing a topic that many people shy away from, but is so important to talk about: erectile dysfunction, or ED for short. This video is all about breaking down the most common myths surrounding ED and separating fact from fiction. Whether you're curious about the condition, concerned about your own health, or just want to be informed, you've come to the right place. Quick reminder: this video is for educational purposes only and is not a substitute for medical advice. If you're dealing with ED, be sure to consult with a healthcare professional. And if you find value in this content, make sure to hit that subscribe button and ring the bell so you never miss a video. Let's jump in. Myth number 1. ED only affects older men. Let's start with one of the most common myths. Erectile dysfunction only happens to older men. While it's true that ED becomes more common with age due to factors like declining testosterone and chronic health issues, it's not limited to older men. In fact, research shows that about 1 in 4 men under 40 experience ED to some degree. Younger men may experience ED due to stress, anxiety, lifestyle factors, or even overuse of substances like alcohol or recreational drugs. The takeaway? ED can affect anyone, regardless of age. Myth number 2, if you have ED, you've lost your libido. Here's another misconception. If you have ED, it means you're not attracted to your partner or you've lost your libido. This is completely false. ED is often a mechanical or psychological issue, not a reflection of desire or attraction. Hormonal imbalances, nerve damage, or even performance anxiety can all interfere with achieving an erection, even if your libido is perfectly healthy. If you're experiencing ED, it's important to separate physical performance from emotional connection. They're not the same thing. Myth number 3. ED is always psychological. Some people think ED is purely psychological, but that's not the full story. While stress, anxiety, and depression can definitely contribute to ED, many cases have a physical root cause. Conditions like diabetes, high blood pressure, cardiovascular disease, and obesity can all affect blood flow, making it difficult to achieve or maintain an erection. In fact, ED is sometimes an early warning sign of these underlying health issues. The key: don't ignore the symptoms. Address them with your doctor to uncover the root cause. Myth number 4. ED is normal and untreatable. One of the most damaging myths is that ED is just part of getting older and there's nothing you can do about it. This couldn't be further from the truth. Thanks to modern medicine, there are many treatment options available, including oral medications, lifestyle changes, therapy, and even advanced treatments like vacuum devices or penile implants. So, if you're experiencing ED, don't suffer in silence. There's help out there. Myth number 5. Only men are affected by ED. ED doesn't just impact men, it can affect relationships as a whole. Partners often feel confused, rejected, or even blamed when ED arises, which can lead to emotional distance or tension. Open communication is crucial. Talking about what's going on and seeking solutions together can actually strengthen your bond. Remember, ED is a shared challenge, not a solo battle. Myth number 6. ED is always caused by porn or masturbation. While excessive porn consumption or frequent masturbation can contribute to performance anxiety or desensitization for some men, they're not the sole causes of ED. For most men, ED is multifactorial, meaning it's caused by a combination of physical, psychological, and lifestyle factors. If you suspect your habits are affecting your performance, consider making adjustments and talking to a professional for guidance. Myth number 7. ED medications work instantly for everyone. Many men assume that ED medications like Viagra or Cialis work instantly for everyone. While these medications are effective for many, they're not a magic solution. They require sexual stimulation to work and might not be effective if there are underlying issues like severe vascular damage or nerve problems. Plus, they can have side effects or interact with other medications, so it's important to use them under medical supervision. Myth number 8. Lifestyle changes don't help ED. Here's a myth that couldn't be more wrong. Lifestyle changes don't make a difference. In reality, improving your overall health through exercise, a balanced diet, quitting smoking, and managing stress can have a profound impact on ED. Since many cases are linked to poor circulation and overall health, These changes are often part of the solution. One of the most harmful myths is that ED somehow diminishes your masculinity. Let's be clear. ED is a medical condition, not a reflection of your worth or identity. It's something that happens to millions of men, and addressing it shows strength, not weakness. The sooner we break the stigma, the sooner more men can get the help they need. Myth number 10. ED is rare. Finally, let's tackle the myth that ED is rare. The truth is, it's incredibly common. Studies show that up to 52% of men experience some form of ED, with the prevalence increasing with age. Knowing you're not alone is the first step toward addressing it. ED is normal, treatable, and nothing to be ashamed of. So, there you have it. 10 common myths about ED debunked. By understanding the facts, you're better equipped to take control of your health and relationships. If you're dealing with ED, remember that help is available, and there's no shame in seeking it. Be proactive, communicate openly, and focus on the solutions that work for you. If you found this video helpful, don't forget to like, share, and subscribe to the channel. Let us know in the comments, what other health topics would you like us to explore? Thanks for watching, and we'll see you in the next video.